Hi everyone, I'm Simone Austin. I'm the manager of the advocacy and policy team here at Dietitians Australia, and I want to introduce you to one of our policy officers, Julia Schindelmeyer. And Julia is the policy officer who looks after the portfolio of mental health. So welcome, Julia.
Thanks, Simone. Hi, everyone. I'm really excited to be in advocacy in the area of mental health. It's an area that's close to my heart.
And I'm going to now ask a few questions of Julia so that we can let you know what is actually happening at DA. So why mental health as a priority area for Dietitians Australia? Julia?
Well, mental health was chosen largely because our members called for it as a focus area. It's also a priority area for the government.
Very important if we're doing any advocacy work. If we're wanting funding, it needs to be a priority of the government. So a really good reason, Julia. And what has Dietitians Australia so far achieved since we've started working in the mental health area?
Well, last year there were several think tanks carried out in each of the priority areas. We have mental health, disability and aged care. The think tanks involved discussions with many dietitians working in the area to identify key asks, I guess, and areas for us to work on. So we put out a call for subject matter leads, and we recruited 2 for mental health, Tracy Burrows and Janice Plain. And since they have been on board, we've also recruited to a working group, and altogether we have developed a briefing paper, and we're currently working on a position paper.
Fantastic. And it's so good to see all the members involved in the think tanks, but also in the working party, and so many passionate dietitians around the area of mental health that can spread to the rest of the profession, because mental health's everyone's business, isn't it?
It certainly is.
What are the main recommendations that you came out in your briefing paper?
So we have 3 main recommendations. 2 of them are linked. So we're calling for greater access to dietitians, specifically APDs, through Medicare. And our second call is to fund more FTE equivalent positions for APDs working in mental health.
Perfect. We certainly need more of those, and everyone can use those briefing papers as well, which is fantastic. So what resources or information have been developed for dietitians?
So currently the briefing paper, that's finalised. It's now available on the website, and we have upcoming resources. We're working on a webinar series, which will be available later in the year. Our first webinar is anticipated to be released in May. We'll have 3, and they will address all kinds of issues in mental health, but it's really an opportunity for APDs to upskill in the area of mental health. Fantastic.
I'll look out for those. So everyone look out in the member news and on SharePlate for advertising of them. So that's what's coming up, and that's what I was going to ask you, but you've already told me about that. So the last bit is, how do I get involved if I'm a member and I want to do a bit more in that mental health space?
Well, if you're interested in advocacy, by all means use the briefing paper as grounds to approach your workplace, your local members, to help promote dietitians in mental health. Also get involved with the mental health interest group if that's something that you're interested in, and definitely, as Simone just said, look out for the webinars that are coming up, and I strongly encourage you, if you're interested in mental health, to participate in those webinars.
Fantastic, Julia. That's a lot of work in mental health. Thank you for all your hard work, and we'll talk again soon.
Thanks, Simone.